My name is Ivy Gamble Cobb, and I am the Executive Director of the Family Center. The Family Center is a nonprofit that was founded in 1994, and our mission is to strengthen families affected by illness, crisis, or loss. The goal of our program is to address the social determinants of health by providing high quality mental health and social services for families in crisis. The Family Center utilizes an interdisciplinary model which brings together legal, social, and behavioral health services to address the myriad needs of families living in poverty. 24 years ago, when I started in this field, I would have never imagined that here 24 years later, I would still be working with this population. I walked into a woman's home who had been recently diagnosed with AIDS. And when I walked into her home, I had preconceived notions about what our conversation was going to look like. And I was so taken aback when her first question to me was, what is going to happen to my child when I'm no longer able to care for them? And I was so taken aback because as a young mother with a young child who was of a similar age, I wondered if I had gotten that same diagnosis, would that be my first question? And from that moment on, I realized that this was the population that I wanted to work with. Women who came from similar backgrounds, from the same as I had, who were caring for children on their own, and yet, despite all of the obstacles that they were confronted with, their major concern was about the betterment of their children. It was my support network that was instrumental in helping me raise my daughter and to also be in a position to better myself so that she would have better outcomes. The community that the Family Center is based in is the community that I grew up in over the last 30 years. My passion continues to grow because we know that we're based in an environment and a community that is in great need. The Family Center is here to be able to address many of the needs of the community. For many of the families that we serve, without the help of the Family Center, the outcomes for the parents and the children would be very different.